Hello to all, I am Vishnu. So, in this video, I'm going to talk to you about interesting aspects of diabetes. Diabetes, you know very well, it's something everybody knows. It is one of the leading reasons of morbidity and mortality in the world. And the problem with diabetes is that it's not just elevated sugar level in the blood, but it also leads to different other kinds of complications. So that is also something which a person with diabetes will not find it so easy to tackle with, unless the particular patient has a very strict diet regimen, and treatment regimen is also good. So basically, you know what is diabetes? It is elevated glucose level in the blood. Now, basically, if you are classifying diabetes, there are lot of types of diabetes, but I will mainly say two types, that is type 1 and type 2. If you go and search books, you will find a lot of other classifications also, MODY, new onset diabetes mellitus, and you have gestational diabetes as well. But here I'll talk about type 1 and type 2. And I'll tell you in simple terms how to understand type 1 and type 2. So basically you need to understand one thing, that our body is composed of cells, billions and trillions of cells. That is why whenever we study biology or human anatomy and physiology, we say that the cell is the structural and functional unit of the body. So cell gives rise to tissue, tissue gives rise to organ, and organ gives rise to organ system. And that is how our body is functioning smoothly. So for the cell to function properly, there is actually a cell organelle which is known as mitochondria, and mitochondria is known as the powerhouse of the cell. For this mitochondria to function properly, it actually requires raw materials. Okay. Like for example, for an industry to increase its production, it requires raw materials. Similarly, for mitochondria to produce ATP and the required energy that our body needs, it also requires raw materials. And that raw material is glucose. So in normal condition, what happens whenever you are consuming food or whatever it is, or maybe, this gluconeogenesis and all these things happen, when glucose is inside the blood, insulin, what it does is, it actually takes these glucose molecules and introduces it into the cell. Insulin will drive these glucose molecules into the cell. The cell will utilize this glucose for producing energy, and that is how we feel energetic throughout the day. Okay? Now what happens in diabetes is, as I said, there are two types of diabetes. One is type 1 and one is type 2. In type 1 diabetes, so basically what happens is insulin is produced from beta cells of islets of Langerhans of the pancreas. Islets of Langerhans, they consist of three types of cells. One is alpha, beta and delta. Alpha produces glucagon, which increases glucose. Beta produces insulin, which controls glucose. And delta produces somatostatin. That is another topic. So when there is a dysregulation between alpha and beta, especially when glucose increases and insulin reduces, that is where we get hyperglycemia, and subsequently we lead to diabetes. Now what happens here is, in type 1 diabetes, there is autoimmune destruction of beta cells. Okay? Autoimmune means what? Your body's immune system considers your own body as enemy, and it starts sending antibodies towards that particular organ. So that is what we see in autoimmune diseases, whether it is psoriasis, whether it is rheumatoid arthritis, whether it is systemic lupus erythematosus, and to some extent type 1 diabetes also. So when there is destruction of beta cells, insulin will not be produced. And that is why in type 1 diabetes, the treatment of choice is insulin. Because insulin is not there at all, because there is autoimmune destruction of beta cells of islets of Langerhans. But in type 2 diabetes, it is a bit different. Beta cells are there, but there are two kinds of problems. First problem, either the insulin quantity that is produced is very low to control the glucose which is there in the blood, or the quantity is okay, the quantity is sufficient, but it does not have potency. Okay, potency means the credibility to neutralize or handle the glucose which is increasing in the blood. So in type 2 diabetes, what happens? Glucose is elevating in the blood, but that glucose is not entering into the cell because insulin is not able to function properly. So the cells start becoming hungry, they start starving, and they start sending stress signals. And they send stress signals to the liver, because liver is the organ that produces glucose, because through the liver only gluconeogenesis and glycogenolysis happens. So as a compensatory mechanism, the liver will produce more glucose. But this glucose is not entering into the cell. This glucose is staying inside the blood only. Again, the cells will produce stress signals. Again, liver will produce glucose. And in response to the elevated amount of glucose that is produced, insulin will try to counteract it. But as I said, there can be two kinds of situation. Situation number one, either the insulin produced is not in sufficient quantity, or it may be in sufficient quantity but not enough to potentiate the entry of glucose into the cell. So here the cell is starving, inside the blood glucose is rising, and insulin is not able to do anything, and this cycle goes on and on. Finally, a stage comes when the cells become completely tired. The insulin is so much inside the blood, but that insulin is not able to do anything, and that stage is called insulin resistance. So insulin resistance is like antimicrobial resistance. If you are giving unnecessary antibiotics for a long period of time, then the bacteria will evolve resistance towards that. Same thing, over a period of time, insulin level is either increasing or it is trying to do something, but it is there inside the blood but not able to do anything, either because of lack of quantity or due to lack of potency. So this condition is known as type 2 diabetes mellitus. And that is why in type 2 diabetes, we directly do not go for insulin first. The treatment of choice is usually metformin, with lifestyle modifications definitely. Metformin, what it does, it increases the potency of insulin. It does not increase the quantity of insulin. Please remember this. Metformin only increases the potency of insulin. It does not increase the quantity of insulin. And that is why hypoglycemia is very, very rarely seen with metformin, unless you are using it with maybe some other oral hypoglycemic agent, like maybe sulfonylurea or maybe insulin or something like that. Alone metformin is okay. Or we use another type of medication which increases the quantity of insulin. So for that we have sulfonylureas, which are also known as insulin secretagogues. That means they increase the quantity of insulin. Like we have glibenclamide, glipizide, glyburide, and all this kind of medicines. And that is why hypoglycemia is very, very commonly seen with these medicines. Why? Because they increase the quantity of insulin. So this is something that I wanted to explain to you in simple terms, how you can understand the difference between type 1 and type 2 diabetes. This is something that I actually attended an online course very long time back, and it was a very detailed online course in which I learned this thing. As you know very well, I have done a lot of online courses. So whatever information I'm getting from there, interesting information, I thought that I should be sharing it with you, and that is what I did. I hope this video is informative for you, and if you want more guidance, then definitely do inbox me at LinkedIn and do be in touch. Thanks a lot for listening to me. See you in the next video. Until then, it's bye.